Hi, everyone. Hello.
Hi.
Hi, how are you?
We're doing well. How are you?
That was like the most seamless Instagram live invitation ever. I've never had anything like that. I was all ready with my glasses to search.
Oh, okay. Perfect. We came at the right time.
So it's so good to like officially see you guys and talk to you
Yeah.
directly. I
Same
love
here.
everything you post, and your lives are, which I appreciate, is it's very informative with the side of sarcasm, and
Yeah.
I loved it. So yeah, so I will let you guys introduce yourself to everyone, and then I'll introduce myself, and then we'll go from there.
Okay.
Sounds good.
Did you want to do the honors or should I?
Oh, okay. So my name is Josie Augustine. So I'm half of the Mental Health Sisters. We're actually a sister group that we formed together to just bring awareness to the community because a lot of mental health issues are either unresolved or unknown to certain people just because there's a lack of awareness regarding what mental health is, how it presents. And while some people may say, well, I'm not anxious or I'm not depressed, if you give them a rating scale, they're endorsing everything. So we're just here to kind of bring that information to the masses in hopes that that will help bring more awareness to groups and allow people to get help when needed. So I do therapy, I do coaching, I also do some testing here and there, and that also helps kind of inform diagnosis, treatment planning, intervention, so on and so forth. And then I will let Dr. Donna do the honors.
Yes, my name is Dr. Diona. I'm the other half of the Mental Health Sisters. I think my sister did a great job of just, explaining what we're all about. We're also about providing culturally competent services because sometimes people would use a one-size-fits-all approach, and that's not necessarily the best when you're dealing with people from diverse backgrounds, races, ethnicities, and so on and so forth. So we are so glad that we have a chance to be here with Dr. Jamie tonight to participate in this live. Thank you for having us.
Yeah, thanks for doing this with me. I was very excited about this. So I'll introduce myself for those that are on here that don't know me. I'm Dr. Jamie Zuckerman. I'm a licensed clinical psychologist outside of Philadelphia, and I work with adults. I specialize in kind of really what you got, anxiety, everyday anxiety, depression. Mostly people come in saying they have stress or they're having relationship difficulties, and that's kind of where it goes to after we kind of get into that. And I work with anxiety and depression. I have a kind of a small specialty in health psychology, so I see a lot of neurological diseases because I used to work in a neurology practice, so it kind of went from there. And then over, I would say the last, 5-ish, 7 years, I have somehow managed to become very well versed in working with significant others of a narcissistic partner. So I see mostly females, but a couple men, but mostly females who are struggling either in post-divorce, going through a divorce, or trying to get out of a relationship with a narcissistic personality disorder, even though we don't say that anymore, but somebody on that far end of the spectrum, we'll say. So that's what I do. Yeah.
Yes. We are running in the same circles right
now. So I guess I'll have you guys kind of explain the post and how that resonated, and then I'll go into kind of what I meant by that, and then we'll just kind of take it from there.
Sounds good. So, of course, we always love to look at your posts, like, comment, engage. And you recently posted a post, and it was actually a quote by Amber Bloom. And the minute we saw it, it kind of reminded us of other questions that we've gotten either on other lives that we've done, our YouTube page, or in our DMs. And we were like, you know what, this would probably be the best forum for us to delve a little bit more in depth on that topic. And the quote said, "You will keep reliving the same pain through different people until you heal the wound that you're trying to heal through them.
Yeah.
And that's
We're all too familiar with
Yeah.
yeah, it really resonated with us. Of course, we've been there. We know what it's like to have those patterns.
Right.
We're all about, as Dr. Joe mentioned earlier, raising awareness so that people can actually learn where they're going wrong, and then what steps can they take to heal those wounds so that they don't keep repeating the same patterns.
Mm-hmm. Yeah, absolutely. And I had just spoken about this last night. Well, first of all, Amber Bloom, let me just, if you are not following her, follow her. Her page has some of the most brilliant quotes I have seen. She's excellent. So I highly recommend her. But it's kind of piggyback on what you were saying. I was talking about this last night, that there's so many, I'm going to go as far as say everybody has some version of a toxic pattern. Not all the time in their life, not in every situation, but in certain situations, it shows its head, let's say, more than others. But that's not the issue. The issue is exactly what you said. You hit the nail on the head, that it's the lack of awareness that you even have a toxic pattern.
Yes.
Without that awareness, you can't do anything about it. In fact, well, I'm sure we'll get into this, but that pattern that people have, even if they don't have awareness of it, they protect that pattern fiercely, right? They
big time.
Right. So not only do they not know they have it, but they also don't realize that they're protecting it.
Right.
As if it's like their child, like they're not going to let anybody take it from them. They're not going to let anybody challenge it. And their relationships become a direct result, and the condition of their relationships become a direct result of trying to protect that toxic pattern. That now, before everyone says like, oh my gosh, I know something's wrong with me. We all have toxic patterns. And the reason why we have them is because growing up, whatever you were dealing with it in your household, even if it was a healthy, stable, upbringing, children develop patterns as a way to deal with their environment, right? A way to find control and navigate their environment. So a lot of the patterns that worked for us then made sense. And as children, we're smart. We come up with ways, we don't give kids enough credit, but we're smart enough to come up with those ways to navigate our world. The problem is when those patterns continue into adulthood, when the context no longer matches the context you needed them growing up in. If you change, you have healthier relationships, healthier patterns. If you don't change, you have more toxic ones. But it's exactly what you said, the awareness. And then once you have the awareness, then you have to have the willingness to change. So I'll toss it back to you guys for the awareness part, because that is the biggest piece. I don't think people realize that.
Right. And I would have to say it's very difficult to even become aware of these patterns without a therapist.
Yes. Thank you. Thank you. Thank you.
It's like it takes someone on the outside.
Objective.
Right.
Yes.
And take a look and see, I've noticed something that keeps repeating. And it's like, okay, here's the thing that keeps going on in all of your relationships. And then that's what forms the connection for you. Because another way that a lot of people will keep reliving these same pains that they have dealt with is through treating other people like objects. And they don't realize it. So oftentimes I will find people who are in relationships and they're almost dealing with someone who's similar to a parent who disappointed them, who didn't meet their need in some way. And what they end up doing is fulfilling needs through these people, but they're not seeing them as whole individuals. So I remember I had one client, and she was...
That is so well said.
Yeah.
So well said.
Thank you. But she was in this toxic relationship, and I was kind of asking her, well, why do you hang on to him? What's so great about him that you feel that this is a relationship you should continue to pursue? And she's like, oh, well, he does this and he does that, and he does this for me, and he does that, and he does this. And I said, you literally described this man in terms of what he does for you. You didn't describe his character.
Yes.
You didn't describe him as a whole person. You didn't describe him as someone you admire. Could it be that you're more attracted to this person for the needs that they're fulfilling for you rather than the person in and of themselves. And they were like,
Yes,
thought of it that way.
yes, that's one of those moments where I love being a psychologist, where you hear that and you're like, and you see their face kind of, it's like there's nowhere to run. Like, here it is. This is what you're doing. But yeah, it's true. And what I want to clarify, because I know I'm going to get questions about this. Yes, some people show their love by, we know this, our love languages. Some people show love by doing things, right? By giving things, by, serving others, just doing things for others. And that's not what you're talking about.
No.
There's a distinct difference. That's what you're talking about, is you're only loving a very small aspect of the person that you make the entire person, when there are so many other pieces to them that aren't in your dynamic equation at all. And it's so there's a difference, because I know people say, well, my husband shows me love by doing this, this, and this. It's not the same thing.
Right.
It's not the same thing.
Because you only see that person in terms of fulfilling your needs rather than a whole. So now, if they have something else going on and they're not available to you, you start to think, oh my God, I don't know why I'm in a relationship with this person.
Yes.
They're not available.
They're all bad.
You don't realize outside of you,
yes,
you're a whole person.
Yes. Yes. I love that. And I think that, I think everyone watching right now is probably taking inventory. Do I do that? Do I do so? But when people come into my office and they say they're very stressed out, they don't have a good relationship with their family member or their siblings or parents, whatever relationships, and one of the first things I do is I have them kind of describe the dynamic and what goes on and what type of arguments they have, when they have the arguments, what it looks like, what their role is in their family. Everybody has a role. And then, over time, kind of go through all the relationships, and I actually have them map it out for me with arrows. And by the end of the session, it looks like, you can't even understand it, but you can. And there's arrows going everywhere. And what they realize is that the pattern in which, let's say it was with a parent, let's say they didn't get along with a father or mother, that pattern, whether it's how they responded to the parent, how the parent responded to them, or how they wish they could have responded to the parent, or how they wish the parent could have responded to them, is manifested in every single other domain of their life, in every single relationship somehow. And so the family unit is used to this dynamic, right? And so people outside of that family dynamic, those are people you chose to gravitate towards. And so you're gravitating towards them for a reason, whether it's work, whether it's friends, whether it's, a significant other, doesn't matter. That plays out in those relationships. So you're going to tend to attract people who work in that pattern, which, even if it's toxic, you still kind of favor it, because one, it's familiar. Two, it's all you know. You don't have any reference point, and you have your role. That's all you know. So when you start to shift gears in therapy and you start to realize, oh my God, I'm repeating the same thing. It may not be identical, and I want people to understand that it could be the total opposite of what you were used to, right? Which is pretty common. And that pattern, then you kind of internalize, it's your narrative, that's what you know. And when they realize that this pattern manifests in different areas, and we slowly start to shift their behaviors to change this pattern, every single one in your kind of immediate circle has their own role. You're in a dance. Everyone's for 40 something years. You go left, they go right, you go up, they go down. When you start to go right instead of left, you throw the entire system off balance, right?
Yeah.
And no one likes being off balance. Nobody likes feeling awkward. And that's when you'll have people say to you, you're being selfish, or something's wrong with you, or I don't like this new you. And the reason why they do it, whether they realize it or not, is to push you back to where you were, so that normalcy, toxic normalcy can continue. That's why therapy is so important, so that they can come into our office and we say, no, they're saying this because they want you to kind of swing back into your original role. You're disrupting everybody's kind of, you know, arrows.
Exactly. You're so right, Dr. Jamie. And one of the things you kind of called it a toxic balance. In any system, and family systems are the same, we're always trying to get back to homeostasis.
Yes, exactly.
Balance, okay? So what happens is when you start to go to therapy, and then the therapist or the psychologist is helping you to change your thoughts, change your behaviors, change family dynamics, it's like you threw a monkey wrench into the family dynamics. So, for example, I had a client who, in her family, she was the screw up. So when she started therapy and all of a sudden stopped being the screw up, they would still find ways to characterize her behavior as that. So it became this label on her forehead that she could never walk away from. And I had to work with her to recognize, you know what? It's not you.
Correct.
The family cannot see the dysfunction, because when you've been in a dysfunctional system for so long, it becomes
you don't know.
normal.
Yep.
So when the person who is in therapy starts to
pull them out,
everyone else looks at them like, what are you doing? That's not the way we do things in the family or the Zuckerman family. What's wrong with you? As opposed to recognizing we're breaking old patterns.
Yes.
Just because it's always been this way does not mean it always has to stay this way.
Yes. And and to kind of go off of that, when people say that all the time, well, you know, I've always been this way. I always thought this way. My next question, well, why? I don't know, because I always have. Okay, but why? I don't know, because I always have. If there's no definitive answer, even if it's an illogical answer, but if there's no answer and it's just, I don't know, because I always have, that's when I tell them that's because that's a narrative. That was a story you were told at an early age, kind of about yourself in relation to the world, you know, who you should be friends with, who you shouldn't be friends with, what you should do, what you shouldn't do, what you should eat, what you shouldn't eat. I mean, literally everything. And you internalize that narrative, and it's when your narrative no longer lines up with your experiences as you get older that discrepancy starts to make you look at things objectively. You hope, right? When they don't, that's when those toxic patterns become really difficult to see, because you have no separation between that narrative and your patterns and what the reality of, you know, the world is around you, or at least your reality of the world around you. So I think it's important to understand that when you do start making those changes, everybody has been in this role for so long. And, you know, even if you're dealing something, you know, I gave this example yesterday. Even when you're dealing with substance abuse and you have somebody in their unit, let's say they had abused drugs for years, now they're sober. Even that person, which clearly nobody, you hope wants them to be using drugs, but their sobriety is a massive behavioral shift. And even though it's healthy, when they are no longer using, they're surrounded more likely than not by a lot of enabling forces. And when those people can't engage in those enabling behaviors anymore, that's where that toxicity really comes out, because it's not like you want this person to use drugs, but at the same time, you don't know how to respond anymore to this. And the fact that you maybe were engaging in toxic behaviors comes to the surface, and it's kind of a question of, okay, now the people that weren't in therapy are now having to see this, and what do they do with that?
Right. And it's so funny because sometimes people don't realize what ends up leading to these, behaviors that become so habitual that they're hard to break. But it reminds me of this story where there was this family, and for some reason, whenever they were having Thanksgiving dinner, they would always kind of cut the legs off the turkey or whatever it might be. And, one of the children were asking, why do we do that? And they're like, oh, this is just how it's done. Going all the way back to the beginning, come to find out, grandmother's pot wasn't big enough, and that's why she cut the legs off of the turkey.
Yes.
So sometimes you'll find that even someone's toxic pattern is an adaptation
Love that.
for a generation before.
Yes.
So you see that a lot with European cultures and people who immigrate to the United States, because in that environment, that was adaptive. In that
Exactly.
it was adaptive to not be in your feelings
Yes.
all the time. It
Yes.
was adaptive to be in survival mode. It was adaptive to
Oh, you needed to shut up and keep that under. You didn't talk about it. Yeah, there was no talking about it. Right.
Yeah. So it was adaptive. But now that you live here, like your parents, they moved here, you were born here, you're carrying the same pattern that was adaptive for your parents in that environment, but now you're in a different one and you're not thing.
Yes.
Because you think this is just how it's done.
Right.
Not recognizing that that was done back then because this is what enabled us to survive at that time.
Yeah. Correct. That's right.
And that's
absolutely
kind of
right.
what you mentioned earlier, Dr. Jamie, about the changing context. A lot of us are not paying attention to the changing context and asking ourselves, in what ways does my behavior need to change to help me in this particular phase or stage of life? Just doing the same old things that we always did or that we always saw our parents or other family members do.
Right.
Absolutely. And, you know, and this is why people say, you know, why do I keep attracting the same types of partners? Or, you know, I'm in the same situation a year ago. Nothing's changed. Nothing's different. And a lot of people are really, obviously change is uncomfortable. We know that. But people are also very scared to give up this kind of blueprint of how they lived their life. They're really like stripping themselves and starting over. And if you have limited support, or if you have people around you that don't understand or are kind of pushing against this change for you, it's very scary and it's very isolating and it's hard work. It's not easy because those patterns, like I said, they are fiercely protected, and without those patterns, a lot of stuff's going to start to come up. And so, you know, as long as people think they're engaging in those patterns, it kind of keeps this other stuff at bay, but it really doesn't. And that's kind of that wounded place that, you know, that people don't want to go near. And I get, you know, we get it, but if you don't, you're going to repeat that same pain over and over and over again, because nobody else can fix that. Nobody's going to say, you shouldn't be with me because, you know, clearly your unresolved pain is going to affect our dynamic. No one's going to say that, right?
Exactly.
Very true. And when you were saying that, it actually reminded me, years ago, I had a client who every single relationship she brought up, if the guy wasn't already in another relationship, he was working like 80 hours a week. And then she would come to the session and complain about the fact, you know, he never has time for me. He doesn't do this for me. And then I started to ask her, you know, let's talk about your family. And then she eventually revealed dad was physically present in that every once in a while he would visit, but then he would disappear. And I asked her, do you think it's possible that the reason why you're going after these emotionally unavailable men is there's a small part of you, the young part of you, that hopes that if you could win them over, it would be like winning dad over?
Yes.
And her jaw kind of dropped like, oh. And I'm like, think about it. When kids create patterns, it's not just what we see our parents do, it's what we don't see.
Correct.
It's those things that we should have had access to that we did not have access to. And we spend a lot of our lives trying to get access to that thing, but unfortunately do it in ways that decrease the likelihood that we'll get what we're looking for.
Yes.
So one of the things I always tell people, your interactions with your family growing up, it creates the blueprint for how you interact with other people.
Yes.
But sometimes you have to change the blueprint.
Yes.
If the door's on the left, but the blueprint says it's on the right, you need a new blueprint.
Yes. 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 I could not agree more.
Right.
Yeah. And again, it's that changing of the blueprint that people sometimes, going back to awareness, don't even realize that there's a blueprint to change.
Yes.
They don't even realize that there's another way to be, right? So sometimes even that alone is enough to, you know, make people kind of take pause and kind of figure out, you know, it's a scary pause. But that aha moment that they have, you know, what you're talking about is, do you think it's maybe that you're trying, if you win over these guys and they spend more time with you than they do at work, then you somehow have, you know, kind of mastered that dynamic. You fixed it, you solved it, because you weren't going to get it from your dad, right? And the opposite is true also. You know, sometimes it's, you know, let's say, for example, you have a parent that is extremely overbearing, right? You can't have anything to yourself, right? You can't have plans, you can't have conversations, very intrusive, where nothing really is your own. And then, so during childhood, you shut down. You keep everything inside. You are not vocal. You don't express your feelings. You kind of become a little hardened, not because you're a bad person, but because that's the only thing you had control over, to kind of block this parent, put some separation between the two of you, because you can't, as a child, say, you know, you're invading my space. I feel I don't have control over things. You can't say that. So they
definitely can't say that in Caribbean families.
Right. Exactly. Correct. Exactly. So when you shut down as your only way to kind of manage that situation, right? Because it won't go over well if you say really anything else, especially with a hovering parent. I mean, you're not allowed to have your own opinions. Everything has to be shared. And so when you gravitate when you grow into adulthood and gravitate towards people, you know, that kind of, we talk about either kind of this end of things, or most people go to the opposite, and then we kind of work them to the middle. But they may find themselves going for somebody who is totally emotionally shut down, right? Because it feels safe. But then what they may do is kind of try to extract emotions from that person, as kind of almost as you were saying, but almost in reverse. And so that happens as well too. So it's usually something that goes in extremes.
It does.
And it's, you know, people think that it's the repetition of the pattern. It can very much be that pattern that you saw, things you did not see, right? Because a lot of times traumas that people have are the things they didn't get. Right? Not the things that were necessarily present, but the things that were absent are traumatic as well. Neglect, abandonment, things that were not present. And so as you work your way to the middle, that person in particular is going to have to get comfortable, right? Finding somebody who is not emotionally shut down, you know, who is maybe a little bit more vocal, and that's going to maybe feel pressuring to them, that they're going to have conversations. They don't want to have conversations because it's draining. Everything gets pulled from them because that's what they were used to. An emotionally shut down person is safe to them. So it can really go really any way, but I think, you know, exactly what you said, being able to identify that specific pattern or specific dynamic that you're trying to recreate in one way or another. But I want to actually, can you guys, because I think this is super important, talk about why a certain pattern may develop, like from a cultural standpoint, and how that isn't necessarily a toxic pattern, even if it doesn't work later on. Do you know what I'm saying? Like, I think what you were talking about, it's more of, it's not, nothing about it is toxic. And so I want people to understand that if they're hearing some of these things and saying, yeah, but that's kind of how, you know, it's more of a cultural thing than a personality thing, if that makes sense. If I'm explaining that well, because I think that's important.
You are.
Yeah, okay. I think we're getting what you're saying, but I feel like one of the clear examples of that would be boundaries. I think that because a lot of Caribbean cultures, I think, can relate, and even Asian cultures can relate in terms of boundaries, because usually when I put a post like that, that's usually the groups that I see that are like, yes. But I think one of the things that Caribbean and Asian cultures kind of treat you to do, it's like you're always thinking of the family. You're always putting their needs ahead of your own. You're always considering how things will look upon the family. You're always supposed to be available to family. You're always supposed to be able to do these things. And what ends up happening over time is when you come to a country like this that is telling you to be independent and
Yes.
do this and pursue these goals and be ambitious. And it's almost like it doesn't work sometimes in the sense that if you're dealing with you're like kind of like the culture here, you'll be seen as someone who's codependent.
Yes, needy, clingy. Yeah.
You'll be seen as someone who has poor boundaries. You'll be seen as someone who is, you know, you do too much. You're not doing enough for yourself.
Yeah.
You'll be seen as someone who can't think independently. You'll be seen as someone who, it's almost like they're, how could I say this? You know how in this culture it looks good to always be busy?
Yes.
It's almost like now you're looked down upon because you don't have that same drive or push because your priorities are a little bit different.
Yes. So it looks like you're not paying attention to yours, and you personally are being busy with your own stuff. It's kind of focused on other people, so it's not right. It's like people here, they feel they should get rewarded for being busy. It's kind of like it's a status symbol almost to be busy, right?
Exactly.
Yeah.
But then when you're dealing, it's kind of weird actually, because you have problems in both cultures. If you gravitate towards the culture here, your family culture kind of looks at you like you're so selfish. Like, oh my God, like you only think about yourself. You never have time. You never want to do anything for everyone, etc. But then if you're on the other side and you're in this culture, they're like, you know, like, do you always have to say yes? Don't you know how to say no? So it can impact your relationships depending on who you're with, and people view you as a particular way or as having a particular personality pattern simply because of the way that you were raised. Because when you're growing up in two cultures,
that's exactly what I meant. You said that way better than I was trying to explain.
It can be confusing to navigate. Talk about navigating these different patterns, because at home you're expected to be one way, at school and with your friends you're expected to be another way, and then as you grow older, you go to college, there's more of an expectation to be like the society that we live in. But when you come back home, you have to deal with that fallout as well. So it can be confusing, and I would say that some people may even view these people as being flaky. But it's not necessarily flaky as much as it's a survival technique.
Yeah.
With this culture, I'll act like this so that I can survive in this environment. But when I'm with this culture, I'll kind of adapt or adjust like this so that I can survive in that environment as well.
Yeah. Yes. That sounds exhausting.
It
sounds exhausting. Sounds exhausting. So I guess then from that standpoint, when people come in then with these, we'll say, toxic patterns, right? One of the bigger things I think that's, again, and this is why I wanted you to bring this up, to automatically not assume that it is directly related to some sort of toxic upbringing, right? Because you don't want to convey, I mean, they're coming to you, you're a specialist, right? You're the expert. You don't want them to feel that their upbringing was wrong, toxic, or bad, because their patterns that they developed are not like fitting in this particular culture, which is on the surface that all looks the same, obviously, but fundamentally it's two different things. I feel like it's
right. The ideology is different.
Yeah, completely. And I think it's super important for therapists to remember that for sure. Absolutely.
I definitely noticed there are some clients, like, you don't even have to use the words negative or bad. They'll label their family systems themselves.
Right. Yes.
I like to focus more on healthy versus unhealthy.
Yes.
Like it's a spectrum. So rather than saying, oh, this was just outright bad, just helping them to recognize, you know what, in your family, even though this was something everybody did and it was just a norm and understood that this is how we do things, in this context, can you see how this could have been unhealthy for you or unhealthy for the mother-daughter, father-son, sibling-sibling relationship? So that way it's not me just bashing their culture and
Yes.
saying, oh, you know, your culture is horrible.
Yes.
It's more of, you know what, in your family's home country, maybe
Right.
this was something that was actually adaptive and a good thing. But now that you're here and your whole family is here, this is something that you guys are going to have to change. And in addition to that, when it comes to identifying those patterns, you said something so profound. We protect those patterns. I've seen it time and time again with clients, with family, with friends, that when you point it out, they will go to bat for the pattern.
Oh, yeah.
So one of the things that I suggest that people do, especially if you're in therapy, most people do not go to therapy because everything is hunky-dory.
Correct.
If you're in therapy, there is something that is upsetting you. There's something not right. So the therapist or the psychologist is giving you strategies or coping skills or things like that. Don't just automatically assume, no, I'm good, you know, I don't have to change anything. Ask yourself, you know, why did I start seeing Dr. Jamie? Why did I start seeing Dr. Joe? I started seeing them because I felt depressed, or I felt anxious, or I felt like my family was driving me crazy. These tips and strategies that they are providing me are going to help me to pick up on those patterns that I can't pick up on. It's the same concept as being in a room full of trash for a long time. After a while, you don't notice the smell. It's another person walking into the room that goes, whoa, what's that smell?
Yeah, I love that.
Thing
I
with
love that.
family patterns.
Yes.
Sometimes you can't smell it, and it helps to have Dr. Jamie, Dr. Joe to be there and say, what's that smell?
And I find that the people who, because then there's this, and tell me if you guys feel this way too, using that analogy, there's people that do smell it, but won't admit they smell it as another way to protect that pattern because it benefits them significantly.
Right. And that actually taps into, I think, part of their racial and ethnic identity development. Because one of the things that I've noticed is that one of the reasons they fiercely protect these patterns or these systems is because it's almost like to lose it would be to lose who they are. They don't know.
Correct.
And oftentimes when I'm exploring this in therapy, and I'll ask them, well, what are your beliefs? Like, you know, what are your morals? What are your values? What do you hold? They don't know because they just kind of take whatever I'm given, and there's not really that great of boundaries between them and other members of their family. So they hold all of these beliefs or values or morals based on what their family members say. So to dismantle that is to dismantle who they are.
Yes.
So
and betrayal. There's a lot of feelings of you're betraying your family. There's guilt, there's shame.
Dissonance.
Yeah.
Yes, it really does. And I think that you kind of have to give them an identity to anchor onto.
Yes.
And that will help them to explore that more because they realize, oh, that's not me. Because otherwise, it's like I'm tearing down myself and my family, and I don't feel comfortable doing that.
That's right, because they are one. They're one unit. Which again, don't get me wrong. You know that's great, but there's a different. I guess I should say enmeshed. There's a difference between being a unit, but having your individual identities within that unit, like collectively. Then there's where there are just. Not even no boundaries. There's no differentiation. You are all extensions of each other, and you just kind of rotate around almost. And you know, so I think that I find this more. And again, I see mostly women, so this may be a really biased comment, but I find that the mother-daughter dynamic has, and maybe it's just because women express this more, but the level of guilt, the level of betrayal that a lot of these women feel towards their mother, mostly father too, but really the mother, that if they start to shift and change, and I do a lot of value work with patients. I'll have them, you know, make sure that is your behavior taking you towards what you value or away from what you value. And exactly like you said, if you're telling me values that not only are they not yours, but you don't even know where they come from or what they are or what they mean. They're just there because you were given them, it's really hard to get better because
Yeah.
you don't even know what you're working towards. So so I completely agree with that. And I think when they realize that their values no longer fit with this kind of dynamic that they've been in, they feel a tremendous amount of guilt and shame for a couple reasons. One, because they feel like they're betraying their parent because the parent has such a hold on them, because they have no opinions or views of their own. And the second is, if that person becomes objective to this and realizes that they are a separate person and kind of figures out who they are and what their values are, what their morals are, and where they feel comfortable in the world in relation to others, they may get really angry at, you know, the person who, you know, was responsible for feeding them this narrative. You know, there's a lot of anger, there's a lot of resentment. I have a patient who has such an enmeshed dynamic, and one of the things that I had worked with her on was separating, right?
Yeah.
And the lengths that the parents went to keep her in this dynamic was, I mean, I guess because we're therapists, we know what to see, but it was just like one thing after another of these manipulative tactics to keep them there for a couple reasons. One, because they look at it as betrayal if there's kind of more of a narcissistic quality to it.
Right.
And the other is if there's a part of them that knows that the way they have been, let's say, parenting or instilling values or teaching patterns or what's not being, you know, presented, there's a part of them that may know that it's wrong, bad, you know, maybe you know, if you keep everything to just the family, keep quiet, and then you go off on your own and kind of spread your wings and fly, there's a lot of anger on the parent side because they feel like they'll be exposed. Even if there's nothing to expose, they'll feel that they're going to get exposed, whatever that may look like. It could be nothing. It could be something horrible. But I think that's a big part of it too. But from both directions, that's why I think the parents, I shouldn't say the parents, but the people who were involved in the beginning of when you started to develop these patterns, they also protect your patterns fiercely by way of reinforcing them over and over and over again.
Right. And I think even when it comes to, and there can be a cultural basis to this as well. Like when people come from, you know, countries that are a little bit more unstable, it's adapted to be in control of your kids. So most times these parents kind of want that hold because that hold could save your life.
Yes.
You know? But here it doesn't necessarily work because here encourages more freedom of thought, more freedom of perspective. So when you're deviating, parents are like, whoa. Like you're going.
They're coming from a place of safety.
Right.
Literal safety. Right.
So for them, it's almost like I can't protect you if you're in this direction.
Yes.
So they carry it over.
Which also then, and I don't know if this would happen regardless of culture or if this is more because now you're in this culture, but that message of I can't protect you anymore, I can't help you anymore if you are disconnected from me or you're a separate individual now, it sends the message to the child or adult child or whoever that parent doesn't think they're capable of protecting themselves.
Which is a huge problem.
Yeah. So I don't know. Yeah, I'm interested to hear from your perspective how that pattern then is kind of handled when you kind of have your left leg here, your right leg here, and you're straddling these two cultures with that concept of, okay, well, so she can't protect me because I'm separating myself. So, but I want to be able to protect myself, but she doesn't think I can protect myself, but they think I can protect myself and I should protect myself. So what do you know, like what's your take on that?
I feel like it's a challenge. I don't know what Dr. Diona would add to that, but one of the common issues that I see with clients that come from cultures that are like that is a confidence issue. So lots of times they struggle to feel confident, they struggle to feel capable, they struggle to feel you know, that they're adequate. They struggle to feel that they can handle life. And
Yes.
these clients tend to deal with a lot of anxiety. There's a lot of anxiety going on because it's like, I don't know if I
It's
can.
uncertain. Everything's
Yes,
uncertain.
it's uncertain.
Mhm.
And it gets to a point where that also involves depression, because you're like, I'm 50 years old and I still can't figure this out. Or I'm
Mhm.
50 years old and I still don't feel confident enough to branch out and do what it is that I want
Right.
to do. So it's a lot of times parents forget, and there's this saying that I love. It's like, you know, parents must believe in their children and children must believe in themselves. If even your parents who birthed you don't believe that you can do this, of course you're going to be like, you know, some
That's right.
kids are the type where they'll say to themselves, well, I'm going to prove you wrong.
Correct. Right.
And for that, you know, it ends up being adaptive because they
Right.
fall into that role. But some kids start to, well, you know, if mom and dad thinks I can't, then maybe
maybe they're right. And then you deprive yourself of the opportunity to show yourself you can do it. So you keep avoiding it, and never giving yourself that chance. So it just kind of reconfirms, and that's that fiercely protecting that pattern.
Right. And then you end up showing up as codependent in relationships because I need you to confirm I'm making the right decision.
Yes.
I have to defer to you because I might do the wrong thing.
Yes.
I'm not sure. So it's like you always become kind of like the child, which of course may even make you a target to a narcissist because they realize, oh, you're looking up to me to make all of these decisions, to do all of these things, and then you wonder how.
Gladly.
Right. It's a
Right.
narcissist's dream, for
Yes.
sure.
Yes.
Right.
Somebody had said here about intergenerational trauma, and yes, yeah, first, you know, I can speak to, like, I have a lot of friends that were in this. I kind of, not directly, but this is even, I see this constantly with, so I guess it would be second gen, my friends' parents whose parents were survivors of the Holocaust. And so they have that, most of the, I guess it would be the third generation, a significant amount of anxiety. Generalized, just anxious about anything and everything. And you kind of see that intergenerational trauma, but at one point it made sense. You don't let your kids out of your sight or they'll die, right? You don't tell anybody anything because you'll die. And you know, everything is private and you keep it private. You don't talk, and you protect, and you know, you save, and you know, it's like, I always would joke, like my grandmother would have like 9 million plastic bags. Like, why are you saving all this stuff? Because it's right, it's that pattern of, you'll have nothing, you have to save everything. And so I think that it's intergenerational trauma is very real. I think it's extremely important to assess. I think that it repeats itself, pattern-based repetition, genetic mutations over time. You know, it's very real, and it's very much a big part of whatever generational trauma we're talking about, but whatever the situation, it's a very big part of the anxiety or the depression or the patterns that somebody has. And that's where that topic of cycle breakers comes into play, is that the anxiety that, you know, a grandparent had makes sense. You know, anxiety gives us information. It keeps us safe. It keeps us aware of our environment. You had to be extremely hyper vigilant in a situation like that. You never knew if you were going to live or die, literally and truly. And then it gets passed on to their kids, that same pattern, even though the context is different. And then it gets passed on again to the new generation, even though the context is drastically different. So, but that anxiety is still very much there, but it just has nowhere to land on. There's nowhere to go. It's not effective anymore because you don't have to be as on guard like that anymore. It's just not necessary.
Exactly. And another thing too, when it comes to the intergenerational trauma, as you mentioned, there's the whole epigenetics where we pass it on to the next generation. But there's also the notion that sometimes we think we're over the trauma that our parents or our grandparents handed down to us, and it shows up in other ways.
Yes.
And kids are very perceptive. So going back to the example that you used, where the person whose family was a part of the Holocaust had a lot of anxiety, a child or a grandchild might decide, I'm not going to make my kids anxious. I'm just going to be very laid back, very relaxed, but let's say they're walking somewhere and they see something, they might grab the child's hand
That's right.
a little bit harder. You've already sent a message of
That's right.
danger, danger,
That's right.
watch out, look out.
That's right.
So you're thinking, at least I didn't say to my child things to make them anxious, but it still seeps in. So
That's
you
that
really
stuff you don't
have
see.
to be aware.
Yeah.
Exactly.
Mm-hmm.
Yeah.
I love that example. Yes, it's absolutely true. Absolutely true. It's the stuff that you don't notice. It's not just the word. It's definitely. To be honest with you, I and I don't know how you guys feel about this, but I almost feel like the words are the least important. The least important part.
I know what you mean.
It's almost the modeling of the behaviors. That's really what's kind of
The
sticks.
thought patterns.
Yep.
Yeah.
Yep. Exactly.
Yeah, the modeling plays a large role,
Huge.
and I like what you said earlier about the mapping. Sometimes it helps to get it on paper.
Yeah.
It's one thing to talk about the family dynamics. It's another thing, like if you create a genogram or mapping with arrows, and then you're like, oh my God, I didn't notice that this is a pattern in my family. That helps too.
Right.
I just did that with somebody who was seeing someone who's definitely toxic in terms of the narcissistic end of things, and I had her kind of draw out all the relationships that she knew of in his world, family, affairs, colleagues, whatever, and then I had her draw arrows to kind of demonstrate what direction everything flowed to. And I mean, I knew it was going to happen, but it wasn't even on her awareness that she draws this, and literally every single hour is focusing to this person, and there's a mess around it. This one's going to this one, this one's going to this, but the one in the middle is just sitting there, right? And so she looked at this, and she was, she was kind of just like, oh my God, it's a whole different thing to see it on paper.
Yes.
And it was just like, you couldn't ignore that. They're sitting there. And everyone around them is running circles around them, for them, through them, and so it's very helpful to draw that out. You really see that toxic pattern.
You do. And it's mind blowing. Yeah. That was
I'm looking at our questions.
Okay.
Should we take some questions?
Sure.
Before we
Before they kick us out.
before they kick us out. Let's see. Energy, we talked about that. Childhood issues become adult issues. Let's see. Why do individuals on the outside, family, friends, nurture the narrative and not your better self or change? It's a toxic culture.
You're assuming they know.
That's what I was about to say.
Yeah.
They might not be aware. Uh-oh, there's a connection.
Oh. You guys froze. Oh no. Oh no, we lost you. Can you still hear me? Can you guys watching hear me? Oh, let's see if we can get them back in. Hang on. Let's see if I can get them back in. Okay. Let's see if this works. All right, we'll try to get them back. If we can't, I will answer the question, and then hopefully they will log back in. Let's try. Let's see what happens. Okay, well, until they log on again, which hopefully they can get back on, I will answer the question. Oh, I see them. Hold on. Oh, yes, we got you. Yay, okay, good. I don't know what happened. I was going to take one of the questions. I'm like, I'll just answer until they come back on. But okay. I saw two questions. One was, why do people not like change if it's toxic? So I'm happy to address that one. The other one was, again, the the idea of the family, why they don't facilitate that change or want you to be that better self. So maybe
Right.
I'll do the first one because then it kind of lends itself to this one. But basically the reason why people don't, it's not that people don't like change, it's that people fear change. It's uncomfortable for them
That's true.
because it means they have to reassess rules, reassess boundaries, reassess who they are, reassess their views on things, their mindset, their values, their moral, everything. And so changing behavior isn't as simple as just doing something different.
Yeah.
If it was that easy, we'd all, everyone would be changing every day and we'd be out of a job. Correct. The reason why people don't change is because they are scared to death of what they will feel, what they will think, what other people will feel and think when they make that change. So it's not the change they're avoiding, it's the anxiety they think they're going to have making that change. And a lot of times changing for the better involves a very uncomfortable kind of perception or mindset shift. That's what makes the behavior so difficult. It's the weight you give to the fear, not necessarily that the behavior itself is something difficult. It's how much kind of how much attention and how much weight you kind of give that icky feeling that you have in your gut. So that's why people avoid change, because here's the thing, like something basic like smoking. You ask somebody who smokes if it's unhealthy for them, there's not one person that's going to tell you, yes, smoking is extremely healthy. You are completely wrong. They all know that it's unhealthy. To stop that pattern of behavior is extremely difficult, which, it's hard to quit. Why don't they stop? What is there to fear about being healthy, right? So if we're using this example, there's nothing to fear about being healthy, but there is something to fear about stopping something that you think calms you down, that you think distracts you, that you think, so if you take that away, stuff's going to come up. Stuff's going to come up and you don't want to deal with that, so you smoke. So that's why people avoid changing, because they're worried about what they will feel and what's going to come up for them.
Right.
Very true.
And then really quickly, from a purely cognitive standpoint, our brains don't like when it can't predict what's next. So if we shift behaviors and things are uncertain, our brains can't predict what comes next, and it makes us very uncomfortable.
Yeah. And then even in terms of, you were cut off when saying this, sometimes people don't even know that they're nurturing, toxic behavior. They're trying to
idea.
help people.
They're trying to help.
Yeah. They don't see it that way. So it goes back to being aware that there's a blueprint that can be changed. So that's a big part of it as well.
So if you guys, I guess, so that kind of answers that as far as why wouldn't they want you to be a better self? They may not even know that that's an option.
Right.
They don't know there's another way to be, because again, if they have to acknowledge that, then that means they have to shift too.
Exactly.
Which becomes scary.
Very. All right, so this is going to probably throw us off soon, but we'll take one. Do we have to change our family's view of us to completely change a dysfunctional dynamic? That's a great question.
Honestly, sometimes you can't change their perception of you. I always tell people, when you're in therapy, you're a catalyst. Sometimes people will respond positively, sometimes they won't, but you just have to do what Dr. Jamie mentioned earlier, live according to your beliefs and values.
Right.
But you're not a $100 bill, you're not going to please everybody.
And the other thing too, is changing somebody's view is not necessary for you to shift a behavior, because one doesn't have an effect on the other. One is kind of what you're thinking, and the other one is what you're doing. And while they kind of blend into each other, the truth is you can change your behavior regardless of someone's view of you. Right. I mean, I could start, I don't know, singing right now, and people could think I'm weird, but I'll keep singing, right? So it's kind of like you can still do what you need to do and follow your values and your morals, even if they're different. You don't need you don't need to convince somebody else to see you a certain way. It's not necessary. It would be great, but it's not necessary.
No.
Right. And
because that would involve them changing.
Right. And I think it even taps into that whole validation talk too. You don't need that validation from your family members. And I think that's something we have to grow out of sometimes. But you have to be able to self-validate and move forward knowing that you're doing what you're wanting to do. Yeah.
And that's hard, especially if that's all you know is your worth based on other people's perceptions of you. Which, is a very big trigger for depression, and dysthymia and things like that. So,
right.
I think that's great information. All right, let's see. So we've been on about an hour. If anyone listening has any questions at all, for, any of us, feel free to send us a DM. I will save this live on my IGTV, and you guys can access it whenever, and I'll tag you in it so you can post it to your page. But we definitely should do this again. This was great. This was great, and I knew it would be because how you guys look at relationships and patterns. When I watched that live the other time, I was like, yes, she gets it. She gets it. Yes, she gets it. I was so excited. So I think that you guys are brilliant, and the way you explain things is just so. You explain it in a way that's very easy to understand and very comforting, and I think it's very helpful for people to hear that, especially about things that are so difficult. So thank you guys so much for coming on, and
thank you.
And we'll do it again for sure.
Well, thank everybody for joining and all the nice comments.
Everyone have a good night.
All right,
you too.
Bye.
Bye.
Bye.